Hi, Dr. Dave Webster, and this is a part 2 of a 3-part video series on the PET Predict trial, and this one is the most important. It's going to be the longest of hopefully all my videos, so please be patient, but I will, at the end of this video series of 3, I'm going to make a very short version that just covers all of the important points, but this is why the trial was declared unethical, and I think it's important that it be long and detailed a little bit more, because so that you really will truly understand why there has been such unprecedented condemnation of the Ontario Liberal government and their medical experts. Remember, their job was to discredit, delay, and block PET from all cancer patients. But as you will see, they really went out of their way, in a big way, to single out Ontario women with breast cancer to reasons that are only known to them, but perhaps it's time they explain. So remember, one of the questions I'm asking is just what does the Liberal government have against women with breast cancer? So, the PET Predict trial version 1. Now, the trial would specifically restrict itself to patients with early stage breast cancer. So, what does that mean? Well, cancers are typically staged 1 out of 4. There may be substages and so on, but typically if you have stage 1 or 2 cancer, you have a better outlook. By definition, the patients they chose, stage 1 is the primary cancer itself in the breast must be 20 millimeters or less than 2 centimeters, in other words, less than 2 centimeters in size. And if there is a metastasis or spread to the lymph nodes, as we've seen in the axilla or elsewhere, that they, by definition, must be less than 2 millimeters, thus the name micrometastasis, because they can only be identified under a microscope. Now, stage 2, they can have a larger breast cancer, up to 5 centimeters in this case, or just 50 millimeters, as we see there. But if, again, there's metastasis, they all must be, again, microscopic, less than 2 millimeters, with one allowed to be greater than 2 millimeters. In other words, lymph node metastasis, that not a single type of imaging device, be it PET, CT, MR, or otherwise, in that time of running the experiment, and that exists today, that could actually detect this beyond a microscope. So let's just look at that again. I've made this statement about not able to detect except with the microscope. So let's look at our model of the breast here again, and the lymph nodes we're talking about here. So here's an example of a microscopic metastasis, less than 2 millimeters, only available under the microscope. But here is an approximately 2 centimeter breast cancer within the breast itself. Now, scanners in 2005, in fact, a little better today, a little bit, but nevertheless, in those days, were actually not identifying cancers in the breast that were already 2 centimeters in size, and they were missing them for various reasons I will go into in some other detail. But the point is that somehow the government has designed it to detect things that are actually 10 times smaller. So, again, these were supposed to be written, great cooperation from the physicians and the community and so on and so forth, nonsense. But so they were written in secret. Somebody leaked us a trial. So I was the president of the ONM. When we saw the leaked copy, our response was, this is unconscionable, and the reasons are obvious. I mean, as I've shown, the PET cameras were simply not physically capable of detecting the cancers. The medical experts, remember, in asking these patients to trust us, we're from the government, we want you to be part of this important experiment, and they're telling these patients that's exactly what they're looking for, cancers that are impossible to identify with the instrument they're going to be using. Now, so that brings into us now the Declaration of Helsinki, first version in 1975. It is a worldwide accepted document that defines what it is to have an ethical or unethical experiment, particularly on humans. Now, it is very clear that a major, part of the declaration is it is blatantly unethical to deliberately design an experiment to fail, which is exactly what they did, of course. Now, remember that the PET scans itself involve radiation, and this would be the equivalent of anywhere from 3 to even 400 chest x-rays worth of radiation. Now, that sounds like a lot, but chest x-rays is actually not that much radiation, but what I don't want to scare people from proper radiation, and this would be a perfectly acceptable amount of radiation, say from a CT scan or a PET scan, if the test was indicated. However, of course, let's forget about the radiation for a moment. What about knowingly and therefore deliberately causing significant increase in stress to these already highly stressed patients, terrified with their new diagnosis of breast cancer? Imagine this was yourself. You're sitting there, you're waiting for the press, your date for your PET scan, then you're lying in this great big machine in a room by yourself and so on, and you're waiting in the doctor's office, waiting for the answer. When the machine couldn't possibly give you the answer they told you they were looking for. You were pawns, clearly. I think is a reasonable description of what you were being used as. Now, but what about the response of the CCO committee when they heard about our meeting of the executive? No comment whatsoever. The trial is simply put on hold, and then the PET Steering Committee and OCOG, Ontario Clinical Oncology Group, would spend, I don't know, it was a year or more, I can't remember exactly, coming up with another version of this trial. And I was reassured repeatedly. I was emailing the one of the lead authors on this paper and so on, and they reassured me everybody's working real hard to come up with a new version for breast cancer patients. But remember, part of their mandate was also to delay PET, and they were a complete success because they now push back even further when they would even begin to consider the possibility of PET scanning for women with breast cancer in Ontario. So version 2, again, it's written in secret. We get a leaked version. It was identical to the first version. In other words, our major objections were entirely ignored. The change that took them all that time to make was so trivial it was not worth mentioning. So I headed that teleconference, and I can tell you the first response of everybody on that call was absolutely stunned silence. We could not believe that these medical physicians, these doctors who'd taken the Hippocratic Oath as we had, were deliberately doing this to these women. And then, followed by outrage and officially saying this was unethical. And as I've said before, this is the triggering point, the tipping point that led to out and galvanize the Canadian nuclear medicine community in particular. But this would eventually lead, it led in 2005 to those motions before declaring the trial unethical. And I won't go through them again, but that's how that happened, right? So, following this, we were outraged, and so there was the Ontario Association of Nuclear Medicine had a press conference at Queen's Park in June of 2005. Now, the response from the government and their experts, and of course, you might have guessed our reliable sources, most trusted sources of media, news, information, and professional journalism, was the following. The Canadian Association of Nuclear Medicine motions and issues are entirely dismissed by Mr. McGuinty, Smitherman, and the Cancer Care Ontario committees and so on, and of course not picked up by our trusted press. So here we are, Mr. McGuinty, Mr. Smitherman, and this is the PET Steering Committee and the OCOG, right? So what happens after the press conference? The PET Predict trial begins in earnest. So, now, but designing the trial to fail wasn't the only violation of the Declaration of Helsinki on ethical experiment. What is very important is if patients are entering a human experiment, they must be given a far more complete explanation of every aspect of the experiment and any controversies. I mean, this isn't just going in for a routine chest X-ray or a CT. That you get an explanation from the tech and your questions are answered. But when you're considering this, you must be aware of every aspect, and in particular, the controversies. So, what were the patients not told? These are some of the things. First of all, obviously, they weren't told that the camera wasn't physically capable of detecting the cancer. I mean, who would be part of that experiment, right? But what they also weren't told was that the health technology assessment tool developed at McMaster University, Evidence-Based School of Medicine, and so on, both to design and to analyze the results of the experiments, had absolutely zero scientifically validation or validity to do these jobs of designing the experiments and examining the outcomes. Now, I'll have more to say about this later, but in fact, that the real purpose, according to Dr. Dobranowski, I'll go into this in more detail when I had a conversation with him in 2009, but the real purpose of this experiment, besides blocking PET, was not to evaluate PET, but to actually use PET, implying that it's already validated, to try and validate their scientifically baseless health technology assessment tool. And of course, that the controversy in particular was that the rest of the world beyond Ontario's borders already knew that PET was not indicated in early stage breast cancer because the PET camera couldn't pick the disease up, period. Now, a little more complicated, another key ethical component is called equipoise. Complicated word, but simple to understand. Consider a drug trial. People, they're trying a drug. So drug A is the active drug, and that's the one they're trying to test. So you'll have two groups of patients, say, one gets the drug blinded, they don't know whether they get it or not, and then you have a control group gets an inactive drug, the placebo group, right? Fine. So you're running the experiment, but if it becomes obvious at any point before the trial ends that this drug is in fact the correct drug for the hypothesis being tested, in other words, that it works, the trial must absolutely be halted immediately, and everyone must get the drug. On the flip side, if it becomes obvious that the drug or experiment will fail, again, the trial must immediately be halted. Now, what I want you to I'll have more to say about this, but I want you to contemplate for a moment. Remember, experiments on humans go through what are called ethics review committees. So this would have gone through ethics review committees, and in particular at McMaster University, where these trials were all set up and designed through, right? So they not only let a trial go through that was clearly, as you can see, unethical inherently by design, but they also, their responsibility doesn't end there. They are supposed to, and they do, follow the results of the experiment, so that if the drug is working or the thing's working, then you stop the trial and so on. But if it's not working, you're also supposed to stop it. And they would have seen those results. So I'll think about that. I'll have more to say about that. But remember, so the PET Predict trial was designed to fail. So the reality is, after 15 or 20 patients, they actually could have known, guess what, it is not working. So I want you to think about this for a moment. How many patients do you think these government experts, these Hippocratic Oath experts, let go through this trial before they stopped it? 336 unsuspecting women, terrified with their new diagnosis of breast cancer, were put through this trial. You can decide for yourselves what the government was doing to these women and why. So, the coup de grace, however, was that, remember, the PET steering committee, in part, one of their jobs is to determine if there's any rules for PET scanning for Ontario's cancer patients. So, as you can see, they really went out of their way in the breast cancer patients. But, so, what happens here is they exclude from the PET trial, the PET Predict trial, the very women with breast cancer that the world beyond the hallways of Cancer Ontario knew would most likely benefit from a PET scan. Think about that. The very patients that would have benefited, they excluded from the scan. Now, to this day, this unethical, bordering on immoral trial is still used as the reason Ms. Winty and Dr. Hoskins used to deny women with the appropriate indications with breast cancer to get a PET scan. We're the only medical jurisdiction that I'm aware of in the world, perhaps the universe, that continues to deny this, that there's any use for PET scanning in patients with breast cancer. So, I've used the word that they have contempt for particularly women with breast cancer. You think the word's too strong? You may have other words you might choose to use. My question to the politicians and their medical experts is this. The time surely has come for you to explain your side of the story, which you have refused to answer to my colleagues and I for all these years. But now you need to face the women with particularly breast cancer and the rest of the patients in this province and explain to them why you have done this to them. And by the way, they're all very proud of what they've done. The question is exactly what is it that they're proud of? Now, and one more demand I'm going to have, which is very critical, and I'll have eventually a site where you can sign a petition. The time surely has come to carry out those 2005 motions demanding an independent and unfettered review by Canadian experts in ethics and health policy to either justify the approach you're so proud of or figure out how this possibly could have happened in Ontario. So, my next video will be part 3, so I've given you all this information, but what does it actually mean for the women that really could benefit from a PET experiment? So what exactly are the implications for you in the Wynne Hoskins evidence-based patients' healthcare system? So again, I'll have a shorter video at the end, and we need to make this an election issue in spite of our professional journalists, and otherwise nothing's going to happen. Thanks.